I'm Nancy Forster, and I have glaucoma. The story begins some years ago when I went into the doctor's office. He said, gee, there's something in there, but it's small, it's slow growing, it could be glaucoma. Don't worry about it. Fast forward some years, went back. He said, gee, there's something in there. It's definitely glaucoma, but it's slow growing. Don't worry about it. And so I didn't. Then the next part of the story is very familiar to all of you, I'm sure. That day, I walked into the doctor's office and he said, gee, you have glaucoma and you have some real pressure in those eyes. And I thought, oh man, I was not supposed to worry about this thing. It was in the back of my mind. I really didn't know who to talk to. I didn't know where to turn. I didn't know what to do. And frankly, it was incredibly scary. So I did the first thing that any of us would have done. I jumped on the internet, and there I saw the Glaucoma Foundation. And I thought, gee, I like the research idea, that maybe that's a point to start, because maybe researchers might know who the doctors are in the area. So I jumped on, and this was so crazy. The banner on the opening page asked all the questions I had asked. Where do I turn? Who do I speak to? What's my life going to look like in the future, especially if my sight is very, very challenged? So I read those and I started to think, gee, this is really interesting. But as a research foundation, I wanted to dig into the research, who the researchers were, and so on. Well, as I looked in that part of the Glaucoma Research Foundation story, I found a really impressive set of folks. They had wonderful scholarship in their background, great accomplishment. Their skills were, interestingly enough, rather diverse, but all seemingly relevant. But I got to tell you, what really blew me out of my chair was their research goal. And this was to cure glaucoma and restore vision. And I thought, the audacity of these people to even commit to such a thing, if that were even their dream. But I thought, this couldn't be real. And I looked further and I looked further, and the research seemed to be pretty seriously directed towards that end. So I thought, whoa, I think they're serious. Next, I noticed something else that was very important to me, and that is their research was collaborative. And the research environments I knew were much more kind of secretive, keep the vest closed, keep it behind the vest, and don't really share, because you want to be the first to come out with a new insight, so your name, your reputation can be built upon that. Here, with collaborative research, I thought, how does this really work? Again, the internet. So I went into the collaborative aspect of the research, and I found that the Research Foundation had a team of incredibly top draw glaucoma experts, the best in the field, it looked like to me. And they were the ones who set the research agenda. Then they invited a scientist to come and apply to work on this project. So what happens is you get people with very different backgrounds and disciplines, but all very committed to this goal. And they're brought on and they meld together as a team, so that if I'm a molecular biologist and I'm working on certain critical molecules, but I need a big gene sorting or a gene sorting kind of project, I could just ship it over to my research colleague, and he could in a flash get that job done. I don't have to relearn an area that I haven't worked with, for one, or for two. It's going to be beautifully well done. Here you see tremendous productivity. And I thought, boy, these folks have an awful lot that appeals to me. Well, I'm starting to think that's a place to go. But you wonder how accessible these kinds of organizations are. And lo and behold, I ran into a friend, a very dynamic, wonderful friend, Mona Zander. And I didn't realize it, but glaucoma was very much in her family, as it may well be in some of yours out there. She said, gee, I'll take you to the best. It's Glaucoma Research Foundation, and I'll introduce you to the folks, and I think you can be very happy there. They've helped my family tremendously, and I've been very involved with them. Great. So I walk in then to Dr. Andy Iwa. Dr. Iwa is the big poobah and such a visionary, such a magnetic kind of guy. Sat down in his chair, still I have to tell you, a little bit nervous. And within no time flat, he says, don't worry. We have so many tools to address your glaucoma, and we're going to monitor you carefully, and we're going to make sure you're on a regimen. And no, you're not going blind. I really like this guy. So we tried one pill, it burned, another pill, it worked great, it wasn't enough, a different pill at night and in the morning. And it turned out that with that very simple, marginally inconvenient procedure, I was on a course. And as I came back and back to Dr. Iwa, my pressure numbers, like my report card, were wonderful. I mean, I was on target. And so, yes, I did stop worrying. And one thing that I discovered from Dr. Iwa, not only is he passionate and committed, but he's very interested in communications. His vision of what research should look like is that it should be shared among the researchers, but then thrown out to the community at large. So the doctors out there could learn about it, the patients, other scientists and researchers, people who manufacture medical devices, big pharma who has an interest in the medications and producing that. Well, what a great idea. And toward that end, there are some events you probably heard of. One, Glaucoma 360, which is a 2-day seminar of the real leading edge of the field. And almost 1,000 people come to that, 200 more every year, it seems like. It's just growing and becoming the place to go to really get updated in this field. So I gotta say, I'm thinking, boy, they're doing so much for me. What can I do for Glaucoma Research Foundation? And I'm sure you're asking the same question too. And the first and far and away the most important is to become ambassadors for Glaucoma Research Foundation. What that means is you share your enthusiasm with your peers, your friends, your colleagues, and in that enhances the reputation of the foundation. And what that means is the better the reputation, the more exciting scientists they attract, the higher quality work they produce, the higher the responses in the industry to that work. And that in turn builds upon their reputation. Yes, then the second thing you probably could have guessed, donate, donate, donate. Whether it be small, whether it be large, you're showing your support. And at Glaucoma Research Foundation, the money that comes in all goes to these programs that I told you about, this research that you're probably familiar with. It's really well done. And I'll tell you, it makes me feel good. And I hope you feel the same. So have a wonderful, wonderful day. Take notes if you feel like, don't if you don't want to. And I'll be thinking of you all day.